Welcome to Boston Children's Answers Parentcast. I'm your host, Jennifer Arnold. As a doctor and a mom, I'm passionate about helping kids stay happy and healthy. So join me as I chat with other Boston children's experts to find answers for you and your family. Welcome back, everyone. Thanks for joining us today. Today we're going to talk about sickle cell disease. It is a blood disorder that actually leads to lifelong health challenges. As always, let's start with a question from our parent guest.
Hi, I'm Sandra. My son Cameron was just diagnosed with sickle cell disease, and I want to make sure he stays as healthy and active as possible. What should I be doing?
Thank you so much, Sandra. And that is a really common question for parents who have a child with a new diagnosis of sickle cell disease. Well, we are in luck because today we have an expert with us, Dr. Natasha Archer. Dr. Archer is director of the Sickle Cell Program at Dana-Farber, Boston Children's Cancer and Blood Disorders Center. Welcome, Dr. Archer.
Thanks so much. It's so great to be here.
Well, thank you for being here. You know, the two of us go back because we are actually collaborating on some simulation-related work together, which is pretty exciting.
Very much so. Yeah.
But now I get to talk to you about your clinical hat. So, as we dive in, one of the questions I love to ask all of our guest experts is, how did you get into the field that you're in today?
Great. So when I was young, when I was 6 years old, I think I told my parents and other members of my family that I wanted to be a pediatrician. Eventually ended up coming to Boston for residency. And as a resident, I was a Doris and Howard Hyatt Global Health Equity resident, which allowed me to learn how to take care of patients both in Boston, but also in resource-limited settings.
Wow.
And that's when I really became passionate about global health. And when I started to work with Dr. Paul Farmer, the late Dr. Paul Farmer, who led a lot of the work with Partners in Health. And he and his colleagues were doing a lot of great work in Haiti, and I could see myself doing that. And as I went through residency, I started also to fall in love with caring for patients with hematologic and oncologic disorders.
Wow.
And then go to Haiti. I'd meet other patients there who also had hematologic and oncologic disorders, and they didn't have many options. And so I said, this is where I could see myself doing work here in Boston, but also abroad or in resource-limited settings. And so I ended up applying for fellowship, stayed here for that, and, in collaboration with my colleagues in Haiti, helped to set up a sickle cell disease newborn screening and management program.
Wow.
And that's how I, fell into the field of sickle cell disease.
Wow. I mean, what I love about that story and your experience is that you really saw, it sounds like a need, like an unmet need. Mm-hmm. And I think that's what drives so many of us in medicine is we see a population of kids or adults, if you're adult medicine, that just are underserved. And there's no one really, not enough resources or clinical expertise to provide care. And so, so that's what brought you to this field. That's amazing.
Yeah, exciting.
Well, as we dive into the topic, can you tell us for our audience, because not everyone may be familiar with what is sickle cell disease?
Sickle cell disease is an inherited blood disorder. The hemoglobin, which is the protein in the red blood cell, it forms abnormally. And so it makes these rods or polymers, what we call them, and that changes the shape of the red blood cell. Actually forms it in that sickle shape or banana-like shape. And because of that, those cells break open easily or get stuck in blood vessels.
Are there certain populations where it's more common?
Yes. In the U.S., it primarily affects individuals who are Black or African American. I would say about 90% of the individuals are non-Hispanic, Black, African American. But other communities are affected as well. And so it can be seen also in Latin America, Middle Eastern, Indian, Mediterranean.
So it is more broad. That's good for us to know, especially for those of us who are in the clinical side to be thinking about it. now we know like what populations is more common in, but what is the actual incidence of sickle cell disease?
In the United States, we estimate that there are about 100,000 individuals affected. 1 in 365 Black babies that are born have the disease. Wow. And when it comes to sickle cell trait, 1 in 12.
So that's a pretty high number, and something really important for us to be talking about because it affects so many kids and adults. How is it inherited? What are the chances of a baby being born with sickle cell disease?
When you're thinking about inheritance, you're thinking about the parents and how they might pass that on to their child. And not every child that is born to parents with sickle cell trait have the disease.
Yeah.
It's only, it's 25% or 1 in 4 of children or babies with each pregnancy will actually have the disease. 50% might have sickle cell trait, and the other 25% won't have any sickle abnormalities.
Makes sense. And so each pregnancy is its own sort of like risk situation.
Exactly.
Okay, good to know. Always good to refresh our genetics. So talking about the inheritance pattern, parents can be carriers of or essentially have sickle cell trait. Is there anything that parents can do to sort of know if they're at risk or if they are carriers?
Sure. So most individuals with sickle cell trait are asymptomatic, so they don't have symptoms. That's not always the case, but most of the time. And so there are a lot of individuals that don't even know that they have sickle cell trait. If you're planning on growing a family, it's important to know what your sickle cell trait status is. And so there are blood tests that can be done that can figure that out.
Yeah, so there are tests that you can do as a parent to find out if you're a carrier or not. But it's really the newborn screening where we typically identify.
Exactly, yeah.
Thinking about the abnormality, what it does to the actual red blood cells, what are some of the impacts of sickle cell disease?
It's a disease of the blood, and so you could have essentially complications wherever the blood goes.
Wow.
I would say that the most common complication is anemia. That's where it originally got that this other name, sickle cell anemia.
Yeah.
We talked a little bit about the hemoglobin and how those rods are formed, small rods that change the shape of the hemoglobin of the red blood cell and make it that sickle shape.
Yeah, it's almost like a half moon, right?
Yeah,
kind of
exactly.
almost?
Yeah, banana, half moon.
Yeah.
Yeah. And so those red cells are not just changed in shape, but they can also become very stiff and hard. Very different than the round and very flexible red blood cells that are typically circulating throughout the body with healthy hemoglobin. And so that stiffness and stickiness leaves a red cell very prone to break down easily and more quickly than would normally happen. So usually the red blood cells stay in the body for about 120 days. In individuals with sickle cell disease, that could be limited to a day or 3 days.
Wow.
So that rapid breakdown of the blood cells makes it difficult for the body to keep up and to make new red blood cells fast enough in order to prevent that anemia from happening.
Obviously, that potentially could lead to, fatigue, right? And other complications just from having anemia.
Exactly. So fatigue or problems with growth. Obviously, treatment can aid that, but in untreated disease, that's what we can see. We talked a lot about the breakdown of those red blood cells, but that stickiness and that stiffness can also lead to inflammation and actually blockages and
in the blood vessels.
In the blood vessels, yeah. Not allowing for oxygen to get to different parts of the body. So when that happens, in particular in the bones, that can cause severe pain.
And I can tell you, someone who's had a lot of orthopedic complications, bone pain is no joke.
Yeah,
it is awful.
Severe and debilitating. And that can happen also with any other organ, right? And so if, blood is not getting to through blood vessels in the brain, that could result in a stroke.
Wow, that's very serious.
Yeah. If blood is not circulating appropriately in the lungs, that can cause a complication that's called acute chest syndrome. And if blood doesn't get to a part of the body, an organ in the body called the spleen, that could result in the spleen not working well at all, or when blood can't get out of the spleen, it could result in something called splenic sequestration. Fills up, and now there's no longer any circulating red blood cells throughout the body. And all three of those, as just an example, are severe and potentially fatal complications.
So this is a pretty serious disease. And I mean, I remember when I was doing my general pediatrics as a resident, we had so many patients with sickle cell disease, and they were in the hospital, sadly, sometimes for some of those more life-threatening complications. And those are the things that you just hated to see. But even more frequently, pain, sort of what we called then pain crises. And so because of the pain that happens so frequently with some of the patients. And so can you tell us a little bit more about how that's treated?
We try to actually treat as much as we can pain at home, outside of the hospital.
That's great.
A lot of it, in part, is education, recognizing that could be the start of a pain crisis. The first step in management is typically heat to the area and hydration.
Yep.
We then, because we know that inflammation is such a common component of that, we use therapies that reduce that inflammation. But sometimes that's not enough. And so stronger medications like opioids are sometimes used in order to decrease the pain. It's not perfect. And so our goals are really to prevent pain from happening. And that's what we really focus on for our patients.
Prevention is the ideal. What kind of therapies do patients get now to help prevent these complications?
The most widely used therapy for sickle cell disease management is hydroxyurea. It is the number one disease-modifying therapy for sickle cell disease, but is most commonly used in individuals with homozygous sickle cell disease and hemoglobin S beta 0 thalassemia. Those are thought to be the most severe types of sickle cell disease. Now, it can be used in others if they have also severe complications, but most commonly used in those groups of patients. Hydroxyurea is most known for its ability to increase the amount of fetal hemoglobin.
So the fetal hemoglobin doesn't have the abnormality of the sickle format. But normally our body doesn't make much fetal hemoglobin after that fetal time, the newborn period.
Now, when you have an increase in that fetal hemoglobin, then you have less sickle hemoglobin. And then also fetal hemoglobin blocks those polymers or those rods that are formed in sickle cell disease.
So it's pretty beneficial, that fetal hemoglobin.
Yeah. I think another important thing to mention about fetal hemoglobin is babies who are born with sickle cell disease don't show signs of sickle cell disease. And so that's why it's so important to have newborn screening.
Yeah. So that brings us to how do we identify whether or not a child may have sickle cell disease. And, that's, you're right, because in the newborn period, you would not know because they don't have the symptoms of the sickle cell disease yet because they have so much fetal hemoglobin still. So tell us a little bit more about newborn screening and how that helps us identify kids who are at risk.
Yeah, so In the United States, since 2006, all babies who are born are screened for sickle cell disease and other life-threatening disorders. This is a test that's done with just a heel prick and a drop of blood. Of course, we do confirmatory testing once we meet them in the clinic, but this is a quick and easy way to identify individuals early so that we can provide the education and preventative therapies needed to prevent complications.
Yeah, newborn screening is so important. As I see patients in the NICU, right, we get those results back, and then we can say, okay, this is what we're going to do, and start providing that care and counseling with families and things of that nature. So it's really important to know, because otherwise, if you miss it, it could be a life-threatening situation. With so many of the things that we test for in a newborn screen. So can we talk about the cure? Because we do have a cure now for sickle cell disease. How does that work? And you know, who receives that therapy?
So stem cell transplant is the only known cure for sickle cell disease. This was actually the first stem cell transplant actually occurred in the 1980s. It was a little girl who had acute myeloid leukemia, and so had a stem cell transplant from our brother, who was a matched sibling, and that ended up curing her of her leukemia, but also of her sickle cell disease.
Wow.
And so that's when we learned that this was a possible curative option for patients with sickle cell disease.
That's incredible, by the way, story. Like, that young lady, oh my goodness.
I know.
She went through so much, and she helped us to understand so much.
I know. Isn't that, I always like, it is an amazing story how it worked out. And now, now that's offered as an option, you know, but stem cell transplant is a very intense process. And the best outcomes come when there's a matched sibling. With stem cell transplant, less than 20% of individuals with sickle cell disease have a matched sibling option.
Oh, so it's a really small number eligible for that cure, right?
Yeah, or that have the best chance
Okay.
With the stem cell transplant. Because if you don't have a matched sibling, or then the likelihood of that transplant working as well, so and not having complications like rejection or graft versus host disease, that's much higher. And so you're faced with trading one not great disease with sickle cell disease for another not so great one.
Yeah, so those are always the complications of that sort of therapy, which has the potential to cure, but isn't without its own risks.
Exactly.
It sounds like.
Exactly.
I also have heard a lot about gene therapies for sickle cell disease, and we had Dr. Christine Duncan, here on the podcast, and we had an opportunity to deep dive into gene therapies. So just to remind all of our audience, this is just a process of modifying someone's genes so that you can better treat or even cure a disease. So I was wondering if you could tell us a little bit about, what's currently available gene therapy-wise, or what's on the horizon for sickle cell disease.
Gene therapy is a really exciting new option for many patients with sickle cell disease. With gene therapy, instead of getting stem cells from that matched sibling, you use the patient's own stem cells. Those stem cells are collected, they're modified outside of the body, and then infused like an IV transfusion.
Yeah, so just get like a blood transfusion or something, right?
Yeah, exactly. Well, I don't want to make it seem...
No, it's not a blood transfusion. No, that's true.
I don't want to make it seem like
easy.
a walk in the park. It's really very much so intense, like a transplant in many ways, where you do have to, get the same... very similar therapies that you would in order to clear out the bone marrow and clear out a lot of your immune cells So that same chemotherapy that has its own side effects.
Yes, because you need space, right,
Exactly.
for those new cells
Mm-hmm.
to kind of go in and do their thing.
And and it also takes time. Once those stem cells are infused, they have to make their way to the bone marrow,
Yeah.
and then start making new blood cells. So that takes time, and so patients are in the hospital for about 3 to 4 weeks. The whole process takes months, and so. But it's still an amazing and exciting option for patients who don't have that stem cell matched sibling stem cell transplant option as a cure.
Wow. Yeah, so lots of different therapies, potentially a cure, but obviously some challenges with that, and you have to have, ideally you find a match, sibling match. Thinking about all these therapies and like the fact that gene therapies is now evolving as well as treatment options, how have you seen in your career this change the trajectory, sort of the long-term outcomes for kids with sickle cell disease?
I think it's very exciting for our patients. Generally and throughout my career, we've made progress in terms of individuals with sickle cell disease, particularly kids with sickle cell disease, living to adulthood.
And that wasn't always the case.
It wasn't always the case. And when I meet a new patient, I can very confidently say, we can take care of your child.
It's amazing.
It's not always a walk in the park,
No.
I always say, no one patient has every complication, but nobody has no complications, right?
Yeah.
And so it can be difficult, but with, management therapy, with medical management, and sometimes these curative or transformative options, our patients can live like full and happy lives.
It's incredible. And I'm sure so wonderful for Sandra, our parent, to hear. So many amazing things. I love it when I hear these types of, progressions in care for our kids who have, really challenging diagnoses.
I think for us, in terms of the medical community, I think that we and family members and friends of individuals with sickle cell disease, I think we also have to remember that, while individuals are often doing all the things that everybody else is doing, that it's still a challenge to live with sickle cell disease, and it's important that family members and friends understand that and support
Yes.
Individuals with sickle cell disease in the good times and bad times. You know.
That's so important as well. You need to have that infrastructure, that support, because like you said, it's not an easy road necessarily. It's just that we're hopefully continuing to progress in the science to help provide better care. So, Dr. Archer, I always love to ask our experts about what's going on currently related to research. So, what is sort of going on related to sickle cell disease?
Well, everyone is so excited about gene therapy. Now, there are currently 2 FDA-approved products for gene therapy, but everybody's looking to enhance upon those and to understand how we can better provide access to the gene therapies, as well as make it safer for an individual with less of the possible side effects that are associated with the way that we deliver gene therapy now.
That would be a really big game changer as we make it more accessible and safer for patients. That's exciting.
And then also, we know that while sickle cell disease is common in the United States, the majority of patients who are affected are outside of the United States.
Oh.
And they live in, the resource-limited settings that we were talking about earlier, and so may not have access to gene therapy readily. So my group actually focuses a lot on pain, which, again, we talked about is a major complication related to sickle cell disease. And so we are thinking about other medications that can be used to manage that pain when it occurs.
It's just so important that until we can make these other game-changing therapies available, we need to still make sure that we have great options for treating the complications of sickle cell disease, which is really important. Yeah. Well, thank you for all that you do. I mean, you're saving lives. Is there anything related to sickle cell disease that we haven't talked about that you'd love our audience to know?
Well, I would say one of the biggest challenges in treating sickle cell disease is really access to care. Many patients rely on emergency rooms for their really comprehensive sickle cell disease care, in part because there are not enough individuals who specialize, clinicians who specialize in providing sickle cell disease care. That's particularly the case in adulthood. And so that's, I think, a major problem for the sickle cell disease community as they get older. There are also disparities in care, particularly disparities in health outcomes for racial minorities. And so keeping that in mind as we care for our patients with sickle cell disease who predominantly come from a group of racial minorities.
Really important things, especially as we think about and we understand, how health equity really impacts the outcomes for our patients, and we have to really be thoughtful and not forget about those things and how they contribute and how we can hopefully mitigate the impact of those things. Thank you for sharing that.
Of course, yeah.
And now as we wrap up, it's time for doctor's orders. This is the part of the show where you, as a clinician, prescribe an action that parents can take to help raise healthy, happy kids. So what are your doctor's orders today?
One of the things that I think is so important is that we really believe and support our patients. And I think when it comes to pain, that's sometimes hard, because everybody copes differently with pain. And so you might see a patient who has sickle cell disease and severe pain on their phone or, reading a book, and or listening to music. That's a way to cope with pain. But it's so important that everybody, our medical professionals, as well as our families and friends, really believe our patients and support our patients, because it is a very a difficult disease to live with.
Yeah, I think that's so important and such good advice, even for our parent, Sandra, to hear, right? I mean, I can't even imagine. So hard. And we need to support our patients. We have to listen to our patients first and foremost.
Yeah. And that doesn't, that doesn't mean always giving medication. It really means listening.
Yeah.
Right? And supporting.
Yeah. I love that. That's why we do what we do. That's our goal, right? Is to heal suffering. Every person's pain is perceived, at different levels, and it has different impacts on the individual. That care for pain is individualized as well. Dr. Archer, thank you so much for chatting today. I so enjoy working with you. Obviously, I don't get to work with you on sickle cell disease, but I get to work with you in simulation. And I think all the work that you do is making such a difference for our patients. So thank you for being here.
Of course. Thank you for having me. I'm always happy to talk about improving the lives of individuals with sickle cell disease.
Thank you so much for tuning in to today's episode of Boston Children's Answers Parentcast. As always, special thanks to our guest parent, Sandra, and our guest expert, Dr. Archer. If you found this episode helpful, tune into more conversations about pediatric health by listening to us anywhere you subscribe for your podcasts.